Okay, so if you are a brand manager in topical wound care, you already know that the game is all about volume. But here's a thought. What if all that volume is actually built on sand? In this explainer, we are going to dig into a strategy to get beyond just big numbers and build something way more valuable. We are talking about durable brand preference. Let us jump in. So right off the bat, this is the question we have to ask ourselves. Your numbers probably look fantastic. Prescriptions are filling. Clinics are making recommendations. But what really happens the second that patient walks out the door? In the real world of snap decisions at the pharmacy and confusing at-home care, how stable is that volume really? Is it true loyalty or is it just fragile? That is the tension we need to unpack. And that brings us to what we are calling the wound care paradox. Because the theory of how this market is supposed to work and the reality of how it actually plays out for patients, well, they are two completely different stories. So in theory, everything looks great. You've got standardized clinical pathways, so performance should be predictable, right? It all feels stable. But the reality is, it is not. That performance is really just a fragile preference, and it is super prone to something called hidden brand drift. And here's the ticker. The high volume you're so proud of, it does not actually equal stability. In fact, it makes you incredibly vulnerable. Okay, so where is all this vulnerability coming from? It all happens in this critical window we call the post-consultation gap. This is that space of time after the patient leaves the clinic, and it is precisely where brand loyalty goes to die. Let us just walk through the patient's journey, and you will see how this drift happens. I mean, it starts out fine, right? A doctor makes a quick, routine recommendation in the clinic. But then the patient gets home. They're feeling unsure. They go to the pharmacy and maybe the pharmacist quietly suggests a different brand that is on sale or just easier to find. And bam, just like that, a new habit forms around your competitor. Your brand, it has just vanished from the picture. And this quote right here, it absolutely nails the problem. The issue is not persuasion. It is absence from the window where outcomes and defaults are formed. You see, this is not a marketing problem. It is not about having a better message. It's a structural problem. Your brand simply is not there when the real decisions are being made and habits are setting in. And you know what? This is why all that conventional marketing you're doing might actually be backfiring. Pouring more money into detailing of physician education, it does not fix a structural gap. In fact, you might just be spending your budget to reinforce the habits that keep the market leader in power. You're accidentally strengthening the default position, not building your own. So what is the answer? Well, it is going to take a real strategic pivot. This is not about shouting louder. It is about changing the entire game. It is about shifting your brand from being just a product to being an essential part of the healing journey itself. Let us be real for a second. This is probably where your brand is sitting right here. You are just a recommended option. You're basically interchangeable with 2 or 3 other brands. The doctor names the general category, not your specific product. And that leaves the final crucial choice up to a confused patient or a busy pharmacist. Now the goal is to move from that to this. To become an embedded standard of care. This is where your brand isn't just an option anymore. No, it becomes an integral, assumed part of the clinic service. It's what patients expect for a successful recovery. It is the default. So how in the world do you make that happen? Not with a new ad campaign, but with a new service. Imagine this. You offer clinics a follow-up system owned by them, but powered by your brand. It could send out structured patient check-ins on day 2 and day 5. It could detect early signals of complications and create a seamless connection right back to the doctor. All of a sudden, you're not just selling a tube of ointment. You're providing a valuable service that lowers the clinic's workload and gets better outcomes for patients. You're literally part of the tear. Alright, so let's talk about the payoff for making this pivot. When you actually own that follow-up journey, you start to win the one thing that truly matters in this market. You win the brand default. And this really gets to the core of what a brand default is. See, it's not something you can win with a bigger ad budget. It has to be earned. It's built organically through the repeated positive association of your brand with a smoother, less stressful healing process. When your brand becomes the go-to answer for reducing a patient's uncertainty, you have built an incredibly powerful and durable position in the market. So let's just contrast these two models. The old way is a constant fight, right? It relies on episodic persuasion in the clinic, just hoping for brand recall late. But this new model, it builds a routine. It relies on genuine utility and service to become part of the positive outcome. You literally stop fighting for a spot in the market because you've become the standard of the market. Which really brings us to our final question. And I think this is the question every single wound care brand manager needs to be asking themselves. Is your brand just part of the initial advice, easily forgotten, easily substituted? Or is it an indispensable part of the patient's successful outcome? Because the answer to that question is going to define your future.